It's estimated that 1 in 7 people suffer from migraines, and the majority are women. But could green light therapy offer relief? Well, neurologist and headache specialist Dr. Laura Natbony joins us to shed some light on these new findings and offer maybe some new migraine solutions. Thanks for joining us. And these LED green light strips for $10 online, are these effective?
So green light therapy is something that I've personally been excited about for quite some time now. I recommend it to my patients, and I have one that I use. This is mine, that I sit in front of every day. The recent study on green light therapy had participants use green light for 1 to 2 hours a day, and after the 10-week study period, migraine frequency and severity was reduced by 60%, which I think is pretty exciting.
Wow, that's a big, 60% is a big number. Now, you showed a green light versus the green strips. Do they work the same way, or are they different in how they work?
So green light therapy can be gotten from different sources. It's just a narrow, pure band of green light. This is the one I have is an LED emitting diode. And I'm not sure because the studies haven't compared head-to-head the different green light therapies, but I think green light in general can be beneficial in any form that you get it.
So what exactly is the green light doing? Why is it effective against headaches?
Green light, it is a very narrow band frequency, and we think that when it goes through the eye, it calms pain signals and calms this hyperstimulation that the brain is going through, both during a migraine and also between migraine attacks. So it's very calming, soothing, and can help sort of the brain, I say, cool down or calm down.
Right. And people who have migraines typically have like an aura or a pre-syndrome. When should people use the light therapy? Is it they use it several times a day, only when they're going to have migraines, or even when they're not having migraines? What's the usage like?
Yeah, so the more recent study was for preventative therapy, meaning that whether or not you have a headache, you use it every day for 1 to 2 hours. There are other possibilities that you can use it during a migraine attack, especially if you're very sensitive to light. So for my patients specifically, I recommend that if you're going into a dark room and you're in the midst of a pain attack, put the light on, put it to the side, and turn off all other lights. I personally do that, and I also use it every day for prevention for 30 minutes to 2 hours. At night, turn off all the rest of the lights and read an old school book and have the light be my only light source.
You know, why do women get more migraines than men? Why is it more frequent in women?
Because we're lucky, but also because of the effects of hormones, mainly estrogen. So estrogen is a hormone that is higher in women, and estrogen levels fluctuate over the course of a month and also over the course of the lifespan. So if we look at estrogen levels over the course of a month, estrogen levels rise and then abruptly fall right before the menstrual period. And we think it's this rapid decline in estrogen that precipitates migraine attacks during the period. And a lot of women suffer from this estrogen effect.
Got you. Now, there are a lot of common migraine medications on the market, but they have some problems. Yet there's a new crop of medications that might offer better relief. Can you explain some of the differences?
Sure. So the new medications are called CGRP, monoclonal antibodies. CGRP is a protein that everybody has, but those with migraine have higher levels both during attacks and between attacks. So these medications, they basically bind to that excess CGRP and flush it out of the system. What's exciting is that these medications are the first migraine-specific class of preventative medication. Everything that we have used up until this point was originally made for an alternate purpose and then found to be effective for migraine. There are 4 injectables on the market and 1 IV infusion, and the injectables are done at home once a month. The IV, you come to the office every 3 months. They also have less side effects, which I think is important to point out, that they're much better tolerated than the traditional preventative medications that we've used.
All right. Thanks for joining us today.
Thank you so much for having me.